Hey, hope you're doing well out there. It's Dr. Matt here, and I'm actually joined by Mercedes today. And what I wanted to talk about is chiropractic, the pelvis, and sciatica-like discomfort, sciatica pain. In many pregnant women, as things grow and develop and things shift, they get stuck, and you go through the process of pregnancy, may find themselves uncomfortable, and their body's found a polite way of saying, hey, we got to change something, we got to do something a bit different. So what I wanted to talk about today is the importance of assessing the spine and nervous system, and then also I'm going to have Mercedes help demonstrate 2 stretches. And now, actually, I'll get you standing up, and I'll get you facing that way. A lot of times, and actually I'll get you turning right around over here. A lot of times, if you get that gnawing or that pain going from the buttocks down the leg or into the hip, yes, of course we're going to assess the pelvis to see what the alignment's like and to see if the nerves are irritated at all. But we're actually also going to assess the neck as well, because all the messages from here have to travel all the way down to here for you to work at your best. So I want you to think for a moment, I'll get you facing that way. Yeah. We'll get you face right there. Yep. I want you to think for a moment like a water balloon, right? And if you squeeze one end of the water balloon, the other end does this, right? So think about the 2 ends of the spine are closely connected. So we'd assess the pelvic alignment, and then we'd also assess the neck alignment. And a lot of the times, pregnant women do really well under care in terms of helping their bodies work better and just helping things be easier and more comfortable throughout that pregnancy. The other important thing to remember is that I've talked a lot in the past just about your stress response, and really that's one of the things we measure in the office, but you want to be, versus in fight or flight, you want to be more in that healing calm side of your nervous system, especially as you grow and develop, and chiropractic may actually help you get into that state where you're more on the healing calm side of your nervous system. So we'd be assessing the whole spine of the nervous system to see where you're at, and then what are some of the things that you can do at home. So Mercedes, if you want to jump in, I think we're going to talk about number 1. We were just talking about the stretch in terms of getting up into a position like this where you're stretching your glute, opening up your hamstring. And then number 2 is being on the ground with different variations, one where your bum is up on an elevation and one where you're on the floor is the more advanced version. And these are 2 things that have worked really well if you're at home for helping with sciatica.
Yeah, so I have found these 2 stretches have offered some relief in between my regular chiropractic care. So one option is to put your foot up onto an elevated surface, a bench or a chair, and just dip into the stretch there so you can bend your lower knee towards the ground and just kind of open up the hip there and try to relieve some of the pressure.
Sorry, Mary, I'll get you to come around here just so you can see too.
If you're a bit more mobile and a little bit more active, and you can also drop that knee down, and you're going to feel a much deeper stretch in your hip and opening there to feel that stretch. So you can do that on both sides to help open the hips.
So that one, I want to show you a variation. Try sitting on your bum there, right? And try bringing your knee just up there.
Yeah.
Yeah, so you can start with that, and that way you have a space to go as you flex forward as well, right? To accommodate
you can
baby.
Stretch. That's a nice hip opener too. Can be done on the couch.
Yeah, and even on the couch when you're watching your favorite show, relaxing in the evening, you can try that. And I especially liked on the more advanced version, you open up your groin, but also loosen up your glutes and help open up those tissues, because your glutes actually cross over your SI joint, which part of those nerves going down your SI joint and your lumbar spine are part of implicated with sciatica.
Yeah.
So let's see the second one.
The second one, you're just taking a seat on the floor. Here, you're going to go into a split position, and here you're going to lean back just a little bit and roll your knees from side to side. You can hold it there and come back and forth between 4 and 6 times, just opening those hips and feeling the hip joint move in the socket there. It can be done elevated too. If you aren't comfortable getting all the way down the floor, you can prop yourself up, prop your bum up onto a pillow.
Use the edge there.
Yeah, and then it just lifts you up a little bit and makes that position a bit more comfortable down on the ground.
And a little bit easier if you don't quite have the mobility to get down onto the ground.
Yeah.
Perfect. So what I consider is trying those 2 things, right, and being consistent with them, right? And then also, as you do it, anything like this requires consistency, a repeated effort.
Yeah, it's very short time, but every day. Takes 2 minutes.
Absolutely. So 2 minutes, 2 to 5 minutes of your life daily, and then consider the health of your spine and nervous system and how often, yes, of course, I'll get you to turn around. You may be feeling discomfort through here, but a lot of the times nerve irritation up here and down here will be part of the challenge, and that's what we want to clear up as a corrective chiropractor to help your spine, your nervous system, help you heal better and work at your best as you grow and develop baby. We'll sign off.
Yep.
Yeah. We'll see you guys soon out there. Bye for now.